So, for the basic concepts that I saw in Nightingale's work, one, I saw that it started with spirituality. So, she had been called by God to care for those who were sick, Smith and Parker 2020. So, this is related to her commitment to others, which drove her actions to provide care specifically to the British soldiers during the Crimean War. She was very firm with her spirituality because this was a service to God, which was a service to humanity, Smith and Parker 2020. So the second one is that Nightingale saw each person as a whole, and each person interacted with the environment in order to recover from their sicknesses. So, for example, she believed in anti-contagianism, which is basically believing that disease resulted from local environmental sources like water. So that's how people were getting infected and getting these having these illnesses. So, therefore, filth must be eliminated from these local areas to prevent the spread of disease. So essentially, she thought that the environment is important to a patient's health. She stated that nursing involves tending to the environment, which is a part of the healing patients. This is important because the people who because people interact with their environment specifically. And so nurses need to go to the source, which is the environment. In order to help patients get better, we need to also take care of our environment, Smith and Parker 2020. So more specifically, Nightingale focused on ventilation, decreasing noise, making sure that there's enough light in the environment or in those rooms, and that those rooms were clean. So in other words, nurses can manipulate their environment so that the patient is in balance and can respond positively to their environment and therefore heal or become healthier. Dunphy 2020. Third, Nightingale genderized nursing. So she basically believed that the woman's defined a woman's role in caring. And the benefit of this, even though, so Nightingale had a feminist point of view. And what came out of this is that it provided women identity and a source of employment at the time, Dunphy 2020. And then lastly, Nightingale said that believed that observation is crucial to nursing practice because you need to be aware and documenting and recording what's going on, and so that we can take these observations and analyze them in the future and help create help link certain ideas together, which basically is creating nursing theory, which is what we use for nursing practice. So 3 contributions that Florence Nightingale's work made to modern nursing is that, one, she focused on infection prevention, so specifically washing hands. She wanted to ensure that or enforce that workplace safety, stop the spread of infection and diseases. And that ultimately helped decrease the mortality rates while she was caring for those British soldiers during the Crimean War, Dunphy 2020. Secondly, she believed in using statistics and gathering data to improve patient outcomes, Dunphy 2020. And then third, Nightingale established principles and priorities for nursing education so that nursing is seen as a profession which uses evidence-based care, McGaffian 2019. So in Patterns of Knowing, I chose personal knowing to discuss my example. So in my clinical experience last semester, I was listening to a patient who came off really aggressive, or in a sense, extremely assertive when it came to her care. She discussed with me her previous interactions with the healthcare system, which eventually led to her mistrusting the healthcare system. And that's why she learned to, quote unquote, advocate for herself whenever she was in the hospital. So, for example, she had issues when she was trying to obtain her medical records, and she didn't like the way certain healthcare providers talked to her. So by just listening to her story, and her experience, it helped me establish a certain therapeutic communication style with her and to help her see that there are instances in healthcare where she can trust us. So basically, balancing compassion and being direct with her was the best way to deliver healthcare to this specific patient. And again, this is how I believe that personal knowing was key in how I improved the patient's outcome during my clinical experience. And then lastly, for Nightingale's work and relating it to the patterns of knowing to inform today's nurses, I think that that both helped develop nursing theory and practice, Smith and Parker 2020. So more specifically, her work and the pattern of knowing improve nursing practice so that us nurses can enhance the health and the quality of life of patients, families, and the communities that we're going to be serving. So in other words, Nightingale's work and the patterns of knowing help us frame the way we think about a person's health and how we can improve it. Smith and Parker 2020. Thank you.